Okay, so namaste from Mumbai, and I hope that all of you are doing well. And current acute update, too many acutes coming up. What to do? What are the commonest homeopathic remedies we are using? So I thought I should just update you about the commonest remedies coming up in the current situation with the viral, with the acutes, with everything. The number one remedy in the current acute state, which is coming again and again, is the remedy China. Typically chills, heat, sweat. The patient is totally thirstless in every stage except for between the stages. He is thirsty. Need for stimulation. The patient constantly says, I want some spicy tea, I want some soup, I want something, and their mind is very overactive. Too much active mind. I want to do this, I want to do this. Kind of too much of overactive mind with physically exhausted body. Typical for China. China Rs also very useful. China Sulf also very useful, but typically China. So this is the number one remedy which I use. The number two remedy that we are using that you will want to know about is Nux vomica. You see that chills, especially aggravated being uncovered, and dry cough, which is aggravated lying on side, and is better lying on side and aggravated lying on back. With that extreme irritability, doesn't want to be touched, doesn't want to answer at all. Very important remedy. Remember, rainy weather aggravates with coryza and throat related symptom, and materia medica pura, Hahnemann writes, there is a scraping sensation in the throat which is there in Nux vomica and Drosera. Read from chronic diseases. There you read about materia medica of Nux vomica. Nux vomica becomes a very, very important remedy. They want to be covered with a lot of chills and shivering, with dry cough, which is aggravated lying on back, better by lying on side. This cough is more at night. And interestingly, in many cases of Nux vomica, there is a kind of a despair. This is also something you will see. In some cases, you will see Streptococcinum being used. And here the throat is one of the worst symptoms. Recurrent throat related infection and after throat joint problems. No other symptoms you will get. Slight fever, after throat joint problems, Streptococcinum. In all these cases, one of the best potencies is 30 or 200. If you get a mind state, you can give 1 ml. Okay. Next, very, very important remedy, which recently one of my colleagues also shared, is Mercurius. Remember, it's one of the very important remedy for rains. When all remedies fail and rain aggravates and causing throat and nose related symptom aggravated at night. Mercurius, Kali iode, these are very anti-syphilitic remedies, and that's why if you're treating cases which have this current cold, cough, fever, more cold and cough, and they are not getting better, think about this. Remember Dr. P. Sankaran, the great Dr. P. Sankaran, treated many cases with Mercurius. The key indication, throat infection with desire for cold water like phosphorus. Read about it from P. Sankaran's Random Notes on Materia Medica. The great remedy that I want you to remember, the most well-known remedy, Rhus. You would see it very typically, directly you will see the triangular red tip, you will see better by motion, you will see the restlessness, but you will also see desire for a lot of warmth and a person who wants to keep walking all the time. This you will see with Rhus toxicodendron and joint pains. And this is where Rhus alternates very often with Bryonia. Bryonia doesn't want to move. Lot of thirst and desire for soups, and the mind constantly thinking of, how do I earn more money? So constant thinking about business. 3 days were off, so I didn't work for 3 days. Now how do I make up all the money that I missed for 3 days because of COVID? Bryonia. So many more remedies, smaller remedies like Spongia, Heparsal, typically so many more remedies. So these are little updates I wanted to give you, commonest remedies I'm using, but finally you would want to individualize. These are just some clinical hints that I like sharing with all of you. Thank you.